Hi, welcome to the BariNation podcast, where we support the bariatric community with humor, humility, and honesty. I'm April.
I'm Jason.
I'm Natalie.
If you're watching this on YouTube, you already know one of our favorite humans and experts on the whole planet is joining us, Dr. Eric Smith. Hi, Dr. Smith.
What's up? How are you guys?
Hey.
Well, good. Every day we get to talk to you is a good day. Like, we're rocking and rolling.
Oh, wow. I don't know. I bet you say that to everybody.
I mean, we are fortunate.
No, I love talking with you guys too. It's good seeing all of you all.
Yep. Yeah. It's been a hot minute, and we have a very important topic that we are excited to dive in with you today. Many of us reach this stage in our bariatric journey where we just don't want a bariatric anymore, right? We're angry, we're frustrated, we're stalled, we're experiencing regain. The work is getting very difficult. And we really kind of reach this point in our journey where we really do have to make a choice, right? It's this period, the stage that we call the commitment. I don't want to do this anymore. I don't want bariatrics to be my whole life, right? Like, I'm just overwhelmed. I'm over it all. But that is, in fact, the very moment that we need to really actually commit, double down on utilizing all of the tools that we have at our disposal to really find and maintain that happy, healthy weight, right? To reach that personal wellness. So today in our conversation with you, we really want to dive into this concept of what are the tools that we always have at our disposal and how can we utilize them, especially on the days that we just don't want a bariatric anymore.
Well, that's a big topip, but a really good one.
I mean, are we surprised? It's BariNation. This is what we do.
That's true. That's true. Well, I feel like we'll be on episode 4 as we wrap this up. But.
Yeah.
Okay. So before
there's a couple of things that come to my mind when you say that. And so let's just make it really simple and basic on, what tools do we have, right? Obviously your surgical tool, your support tool, your follow-up tool, which goes along, may or may not go along with your support. And that follow-up and support can involve your dietitians, the accountability that you have with wherever you had your surgery. I'll pause there to say some people aren't fortunate enough that maybe they had a good surgery that worked, but they didn't have a good program to follow up with. But I will say, not to sound harsh, but the person that is in that situation, they have to own that and they have to do something about that. And I know that's not always easy, but my goodness, in 2023, we have people like you guys who people can find support with, and you're all not trying to do labs and things like that for people, but it's a start. It's a component of your support. Maybe the patient has to piece together the support, and maybe unfortunately, their only option, because they live in an area where all the bariatric surgeons refuse to take other people's patients, which that's a whole nother talk show, but maybe that's the case. So they get their primary care doc to help them with the lab follow-up, and they find a support group like you guys for that follow-up, and they continue to do that. But at the end of the day, the only person that will benefit or suffer is the person themselves. So they have to own that. And so those are all things, utilizing your surgery, the surgery that you were given. Just because things may not be going your way doesn't necessarily mean the surgery you have is wrong. Sometimes it may not be the best one for you. But you find those things out through follow-up and support. Obviously, a big hot topic, medications, that can be part of one of your tools as well, whether that's a medication to augment your surgery that you have, whether it's somebody who's just on medication. There's people on your all's platform that haven't had surgery. Maybe they're thinking about having surgery. Maybe they have the mindset that maybe this medicine will keep me from having to have surgery. We can definitely touch on that too. But those are kind of the big picture tools, that are in place, and finding out how to utilize those. But the one thing that I want to bring up, that as I heard you say this, you kind of described that scenario of you're in your follow-up, you don't want to, I think you called it, you don't want a bariatric anymore, which is pretty funny. But I totally get what you're saying. You feel like I need a break, right? Mm-hmm. I need a break from having to talk bariatric 24/7. I think I watch patients and they don't want that to identify them, but yet they're so hardcore of having follow-up that they are almost like, how do I not identify as this? Because everything I do is bariatric. My story of my life is bariatric. I motivate others by bariatric. I remind myself that I don't want to go back to where I was, and it takes me back to the fact that I had bariatric surgery. And I'm sure that's overwhelming. I'm sure it's overwhelming for the people who are role models to others, and there's a lot of pressure. So I get what you say, like, I don't want a bariatric anymore. But, and you guys are patients, so you have every right anytime to raise your hand and say, that is not true. You totally missed the boat. But I would be willing to bet a lot of times when you hit that mode of, I don't want a bariatric anymore, there's something else that's going on that makes you feel that way. Like, yeah, you may be burnt out on it, but are you maybe feeling like you're not seeing what you were hoping to see? And the redundancy of bariatricing is starting to wear on you, you know? Like the person who makes a commitment to exercise 5 times a week, like let's say they want to try to become a professional bodybuilder. I don't know, you know, but there's a physical fitness goal, you know, to it. We're not talking about people who are dealing with weight. I'm sure there's times that they burn out, but more often than not, if you talk about those people, when they hit a burnout, it's because they feel like the results have the big famous word stalled or stopped or slowed down, or because we're all motivated by results, right? When things are going well, it pushes us through. I don't really feel like getting up this morning and doing that. I don't feel like really making that choice, but here's my reward, right? We all, as humans, we're susceptible to being, you know, I get my reward, so I'll do it. I want something, right? I want something back. I want something in return, so I'll keep doing it. And I wonder how many times we set ourselves up for failure or to hit that burnout because we are focusing on maybe a stall that isn't really a stall, or are we focusing on the wrong things? I did a podcast or whatever not too long ago, and the conversation was somebody asked about stalls, and I'm like, isn't that our long-term goal of weight loss? Are we supposed to hit a stall? Like, you're not going to lose weight forever. So again, and I'm going to take this back to where we started. So give me just another minute, I promise you. Because if your perception of where you're at is if it's stopped, maybe it's supposed to stop. Maybe it's not your end goal, but maybe you're at that point where things are supposed to slow down. But that should not determine our persistence of doing the things that kept us there, right? It's because and how do we get reminded of that? We get reminded of that by going right back to where we started. Our tools, our follow-up tools, our accountability tools, our community support tools, of reminding ourselves that everybody else has gone through this, and this is part of the process. And I think it's hard when patients, when your end goal is a number, and if that number is not continuing to go in the positive direction, that you feel like you're not having success. But oh my gosh, and you lose sight of what your life is like right now, what your health is like right now, what your self-confidence is like right now, what your job opportunities are like right now. Everybody who chooses to have weight loss surgery, even if it's not how they feel, the politically correct answer is I want to be healthier, right? And I think sometimes we need people to admit, like, I want to get in that dress. I want to get in that, that's okay. But the overall goal is I want to get healthier. And there's not a machine or a scale that we stand on that says ding, healthy, or unhealthy. And I think so we fixate on this number that sometimes puts us in this mindset that now we hit that burnout. I feel like the two go hand in hand, if that makes sense to you all.
No, it makes perfect sense because, in our lifetime of doing diets and all the other things, one of the reasons we, dive off the trail of doing the diets in the first place is once the juice is no longer worth the squeeze, we've put all that work in, and we look at the scale and go, well, this isn't working, so I'm going to go back to what I was doing before. Why am I killing myself eting salads all day and running on a treadmill if it's not going to work? So I'll just go back to eating burgers and whatever else. And it doesn't, the mindset of that, unfortunately, doesn't change, because as we know, just because we cut our stomach out, it doesn't do anything to our brain or our pathways or any of the things that we set ourselves up. Like myself, I had 44 years of experience of doing things the wrong way. And so now that I've had surgery, it's not that it's going to magically be like, oh, well, now I love eating salads and running on the treadmill and never eating burgers or stuff that, would be not deemed quite on my program. So, it's that really, I think, like you said, it really does go hand in hand.
And as I was listening to you say all of that, Dr. Smith, and I think all of that is perfectly spot on for myself. I can't speak for anyone else. But as I was listening to you speak, I realized it's all about the dopamine hit of like, I'm doing a good job and I'm doing what I should be doing. Like that dopamine hit of like getting on the scale or fitting on into that dress, whatever that may be. That's exciting, and that makes you want to continue on. But I hit 2 years, maybe 1.5, 2 years post-op, and I significantly slowed down, and I didn't want to do anything because I was like, why would I measure my food and make sure I'm getting the protein in and water in if I'm not seeing a change on the scale? But that was when, like you said, I had to utilize BariNation itself, the thing that we have created. I had to go back to support groups. Laura Grabo, we all know and love her emotional eating support group. I swear by it. I think it saved my bariatric journey. Tracking my food, getting back to the doctor, getting medications that were helping my mind. All of those things are now putting me in that direction. And yeah, the scale's moving, but it's still not moving that much, but I can see the difference. 10 months later, I can see those differences.
But where is it not moving for you? It's not moving the way that you don't want it to move.
Right.
So why is that not a positive either? Right.
Totally. And that's years and years of conditioning.
Right.
Go ahead, April.
I was going to say that we have such a hard time acknowledging all of the hard work that we've done, because in the back of our brains, and this is me, right? In the back of my brain, I was going to have bariatric surgery. That was the only thing that I was going to need. I was going to lose a ton of weight, and I was finally going to be happy. And when I got down to that low weight, I was so enraged, because I realized that surgery was not going to be the thing that would actually allow me to maintain my low weight. And that anger, that rage, that frustration boiled over in me. And it was like, well, you know what? Forget this. Like, forget this, forget them, forget all of this. I was lied to and I was deceived. And that anger pushed me to a place where I could not get past that deception. And I think for a lot of people, they probably feel the same way, because we do go into surgery thinking, this is the only thing I need. This is it.
And it's not really different than lots of other things that we deal with in life. If you talk to people about relationships, and you talk to therapists about relationships, and I've heard the example used that it will say, okay, if you have let's say you've got a people that are dating, and their relationship is going towards something serious. When you send that text message of, hey, I'm thinking about you, I miss you, are you sending it because that's how you feel, or are you sending it because you can't wait for the response to say the same thing back to you? What is your intention? Is your intention for, as you said, Natalie, the dopamine response, or is it because it's 100% heartfelt and committed? And I think when we make commitments to change things in our lives, we have to do that with the understanding that we may not always get the result that we want, but that should not dictate our behavior. Our behavior has to be consistent, because we can base it on facts, and we know these are the best things for us. And there'll be times I get rewards and times I don't, but it should not dictate if I do the right things for me and my health. you know? And I think if you think about that, some people benefit differently. Some people see the rewards differently, but that reward that shouldn't have to be there to keep us consistent with what we do. And if we can, but what I'm trying to say is I'm really curious, can we help some with the burnout if we gain a better perspective on what that reward is? Like, we could use, Natalie, the example that you just said, the scale's moving, but not as fast as you would want it to. But you actually have a reward when it feels like you don't. Your reward is you're maintaining, right? You're not going back to where you were. As I said, the stall, isn't the stall the point? Because the opposite of a stall, there's two options. It's weight loss or weight gain, and maybe you stall for the next year. So guess what? For the entire year, you, instead of stalling, you maintained,
And that is one of the things that I have had to come to terms with. And I know April, Jason, like, we have had to come to terms and also reframe the way that we think. I was thinking the other day, this is the longest I've ever stayed at the same weight in my entire life.
Right. And that doesn't mean that that doesn't mean that you say, okay, I'm done. Because obviously if you're done and you don't do the things that kept you there, it's going to go the wrong direction. And that doesn't mean a year from now, might not be like, guess what? I've not only maintained, I've maintained it 10 pounds lower than I did the last time I maintained. It's a journey. It's those slow little progress things that you make. But I think if there's a way that we can change our perspective on those, what we feel like are, I don't want to say failures, but non-success, then can we help with those periods of burnout and allow us to enjoy the journey of, this is our life. This is the accountability that we chose. And it doesn't seem like hard work, because hard work, it's not as hard when we feel like we're making progress. So do we need to look at our progress differently? Now, I'm a pretty straight shooter, And so if someone says, well, someone with a surgery maybe should have lost roughly 150 pounds and they lost 80 and they've kept it off, at some point I'm going to be like, 5 years later, like, did you really maximize this to what you want? Let's be honest. But, I think the happiness can't come from a number. It can't come from a person. It can't even come from a family member, because all those things will let us down. It has to come within ourselves. And because April, if you would have hit that number that you thought you were going to hit, and then it's not happy, then you're devastated, like you said. And I think when we do gauge our happiness on the number dropping, we are destined to be furious, even if we hit our goal weight, because our reward has been what? Drop, drop, drop. Mm-hmm. So at some point it has to stop. And if we've been dependent upon dropping, even if somebody loses weight steadily over 2 years, and they are now, okay, that's what kept me going, I'm going to keep doing the right things. When it stops, they will look in the mirror, they will be unhappy, and all hell's going to break loose. Because they've gauged their reward and their success on that, as opposed to seeing the bigger picture. And we don't want to lose sight of what our end goal is, but I think sometimes we miss the progress that we're actually making.
Yep. Well, it's why one of our pillars in BariNation is metabolic wellness, right? It's movement, mindset, metabolic wellness. Metabolic wellness is more than our weight. Metabolic wellness is about how do we live and sustain this healthy life, forever. And while weight is certainly a part of it, it's a set of information. It's not the only set of information. And we chose that term on purpose because we really wanted to decenter, right, our goal around weight. And we wanted to expand our definition of, right, success, or, hitting the mark and being healthy and, personal wellness, all that kind of stuff. It's why it's a pillar of ours. And that shift is critically important, because everybody's going to reach that wall. The commitment is a stage that everybody says they thought they could avoid. No patient can avoid that stage. It's just not possible. And I think a lot of people experience what I do, right? What I did, kind of that rage and that anger. And if I didn't have a safe place to go and vent that anger and get it out and just move it through my system so that I could clearly see the landscape again, I absolutely would have turned to eating higher quantities of food, alcohol. I would have turned to less movement. I would have absolutely ghosted the community. And I just would have said, you know what? No. Because if I did not get to that point where I could safely talk with other people about what I was feeling, and they could validate my feelings as being kind of like normal and, oh, I feel that way too sometimes. And if I wasn't surrounded by information about the obesity model, right, it's a disease. This is a disease. So I'm battling a disease that is never going to leave me. I either need to embrace the disease mentality. I need to embrace the staying even is success. And I need to just let go of that anger. And for me, which I'm not there yet, and a lot of people will know this, but I am getting to this point where I do have to surrender to this diagnosis in a lot of ways, because I did not go into surgery understanding that I had a disease. I went into surgery thinking something was wrong with me. I'm making horrible decisions, and now I need this medical intervention to help me make better decisions.
Right. But you didn't have brain surgery.
Exactly. I know.
Right.
And right back to full circle. And if we're not having these conversations, if we don't have a safe place to have these conversations, and if we're listening to people giving us false hope or false information, that's when it could really go off the rails. That's where we see people ghost, right? They disappear from the community entirely.
Well, and a lot of times those conversations need to be had with ourselves. Like, a lot of that is we start to look for blame in places that it doesn't really belong. Like, the community is too overwhelming, or I don't really identify as a bariatric patient anymore because I'm so far out. I don't really think about it anymore. I don't talk about it anymore. And that's fine. We're not saying that you have to, that has to be your whole identity for the rest of your life at all. Like, I'm not saying that whatsoever. But it is a part of what got you to where you are today. And if you just turn your back on it and go, that's not me anymore, we've seen people tend to have a harder time in everyday normal life when they don't kind of think back to what got them to where they are in the first place, which is that some of those things and some of those guidelines are still going to have to be thoughts in your everyday life, or you're going to have a hard time.
Well, it really all goes back to this word, Dr. Smith. You said it earlier, and as April was speaking and Jason were speaking, the word is ownership. You have to own. It does not have to be your entire identity. I don't go up to strangers I just meet at functions saying, "Hi, I'm Natalie, bariatric patient." Like, that's not what I do, right? Like, I have other facets of me, but where the commitment comes in and where that pivotal moment is really just owning the fact that I have the disease of obesity and I can either treat it or not. And having that conversation, as Jason said, it's daunting, it's uncomfortable, but it's that ownership piece that a lot of people end up missing. And I've missed. I mean, I've gone in and out of the commitment so many times in the last 2 years, just like, I don't want to do this, but I have to because I, have obesity, and going back and forth. But it's that ownership piece that's really missing, and just saying, like, this is what I have. I can treat it or I cannot. Just like cancer, just like a heart disease. It is what it is, and I have it, and I have to choose.
Well, it's different too, because I think it gets overwhelming to the bariatric patient. But you've all heard me try to pull other diseases to make an example all the time to kind of normalize it. And I think it speaks to the lay person to kind of relate the two. But we'll use diabetes as a great example. There's plenty of other medical problems that we could choose and that are relevant, but we use diabetes as an example. If someone's a diabetic, they get to talk, type 2 diabetic. We're not talking about childhood diabetes or type 1, but type 2 diabetic, they're going to get to talk. They should get to talk about some lifestyle changes, some things like that. The A1C starts to creep up. Okay, we're going to have to try you on medicine. This happens, and it continues to escalate. But when the diabetes continues to not get controlled or it's out of control, I should say, it's easy to blame something. And what do you blame? The meds. My disease, it's not treated. So I got to try a different med. I don't have a good enough med. Or I got to try a new med. And really, that person should be owning that no differently than the bariatric patient, right? Well, am I letting my meds, my tool, am I letting it have the best chance to help me? Am I doing the things to help augment my success? And physicians and society and everybody else, they look at that person like, oh, that's just unfortunate. We're gonna have to keep giving you medication. The bariatric surgery patient, it's a lot. It's a big cross to bear of like, oh gosh, I've got my tool, but I'm not seeing the results. I have to own all this. It is overwhelming, but at some day we just have to admit it is what it is. So let's own it. You know what? Let's finally take a stance for a disease that we say, I'm going to help treat my disease. You know, and it's we mentioned the weight loss drugs earlier, and you know, I will never forget when they first started getting popular, and people were like, "Are you scared as a surgeon that you know weight loss drugs are going to put you out of business?" And I'm like, "Well, first of all, if it puts me out of business, then that means people are healthy, and I'll find something else to do. You know, I don't know. I can't dig ditches, but I can do something." But obviously, I'm being sarcastic because we treat such a small portion of people with surgery. There's so many people that need treatment. But I'm like, no, I'm not worried whatsoever, because what happens is people are seeing this in the wrong way. They're not seeing this as a tool, and they're not seeing it as a permanent change. And if a tool is used to fix a problem, the tool has to be present for the rest of their lives. The data is 1000% clear. But yet people still have this perception. If I do this med, I take it for 3 months, I take it for 6 months, I lose the weight, and then my mind's going to be all fixed because this medicine magically soaks through the blood-brain barrier and makes me see everything differently. And I'm going to make all these right choices moving forward. And then guess what? It's no different than the diet they did for 3 months, the keto that they did, or they went vegan for 6 months and then they stopped or whatever that is. And then it comes back. It has to be a permanent change. Bariatric surgery patients have that permanent tool in place, and those behaviors can continue to augment them. And those behaviors can go awry and make your tool less effective, or they can go hardcore and they can make it more effective. And sometimes those behaviors can just keep it middle ground and keep it effective. And it's really no different than all the other diseases, but it gets seen differently. And unfortunately, bariatric surgery patients wear their disease on their sleeve, you know. Mm-hmm. But I think it's a your circumstance. We have to get in the mindset that our circumstance should not dictate our behavior. I think that's a life lesson, and I'm as guilty as everybody else, right? If I want a result and I do it and I do it and I do it and I don't get it, but if I know what I'm doing is the right thing to do, I should do it. You know, my goodness, people can look at their faith that way. They can look at all sorts of things that way. Like if I think that this is who I'm supposed to be, and this is what's going to make me a better father, a better spouse, a better professional, a better surgeon, a better physician, I'm not always going to get those rewards that I want, but I've already made the determination this is the best thing for me, so it should be standard. And that doesn't mean it's always easy. But I think if we can try to remove the reward as the motivation for why we do it, then maybe we can calm our mind a little bit and then start to learn to realize sometimes those rewards are right in front of our face. They're just not the number on a scale all the time.
Well, it's a lot about what we talk about when we say like everybody wants the after picture, but the after is forever. Like you're living in this world of post-op forever. So, you know, once you get to the scale, like you still got to maintain it. Once you're trying to get to the scale, you still got to try to get there. Like this journey, like people are so fixated on the first 12, 18, 24 months, but it's like, don't beat yourself up because you didn't nail something in the first 12 months. You have the rest of your life to get where you want to be. And now you have a tool to help you get there. And the more tools you onboard, the better off your journey is going to be moving forward, whether that be community, whether that be medication, whether that be, therapy, there's tons of things that factor into, adjunct treatment that goes into the post-op life, but don't try to pack it all in the first 12 months. Like you have the rest of your life to get where you want to be.
And that's where I think the tools that we're talking about, that's where that accountability in community and follow-up allows us to be honest with ourselves and with each other. And so it's easy when I remember that's one of the things I hated the most about bands is because it was this foreign thing that was in you. When results weren't good, everybody said, oh, my band's not tight enough. It was always the band wasn't doing the job, right? Because you had something to blame, right? And that's easy. That's human nature. But I think, there is a time when patients, they have surgery, they may not be seeing positive results. I need a medicine. They don't see positive results. I need a revision. They don't see positive results. And there are times when those things are applicable, but we're missing the boat because those aren't the only tools that we mentioned at the beginning of the podcast, right? We also mentioned support. We mentioned accountability. We mentioned follow-up. We mentioned dietary education. We mentioned all those things. But we don't like hearing those answers because those don't tend to be quick fixes, right? And, as you all know, the recent post that we were talking about before we hit record about shortcuts, cheating, quick fixes, it inflames us all. It makes the hair on the back of my neck stand up when people use that term in conjunction with bariatric surgery. But I think as bariatric surgeons and bariatric surgery patients, we have to be very careful, because when we hear society tell us that we did something for a quick fix and we're like, no, that is not correct, and you have no right to say that. But yet then we get mad when we're not getting a quick fix. We're falling right into their trap. And they're sitting back saying, told you so. We have to embrace that. If we're saying, no, this isn't cheating and it's not a quick fix, then we have to embrace that life, that this is a life of health and a life of progress in a positive direction, no matter how slow or sometimes stagnant that may be.
Absolutely. And that's the ownership piece, but also just the conditioning that we've gone through. I mean, we are so conditioned to think that a diet or medication or surgery is just the quick fix, the silver bullet that's going to help me, the magic pill, whatever it is. It's so hard to get out of our brains, but that's where all of the other tools come into place, like the follow-up, like the community, like support groups, like therapy, to help us reframe that mindset. I mean, BariNation, we talk about the 3 pillars, right? We have movement, mindset, and metabolic wellness. And surgery, medications, our nutrition, that's that metabolic wellness piece. But we need mindset help and we need movement in order to be successful. And we try to do just one at a time, but we really do need all 3.
Yeah.
I had an experience this weekend where some things kind of fell into place. So it was beautiful here in the Pacific Northwest. It's been the first weekend that any of us could do any yard work because it's just been, torrential downpour. So Grady and I dedicated our Saturday to yard work. And, we worked for an hour and then we would take a break. We'd work for an hour and take a break, right? And at the end of it, I sat down next to our fire pit, and Grady sat down and joined me, and he goes, oh my God, this is like, we're never going to get ahead of this. And I just remember looking at him and I was like, wait a minute, you wanted this big, huge palatial yard. You were so excited for this. And now you are bitching and you are so down on yourself because we couldn't get it done in one day. And literally, I was saying this to myself and I was like, oh my God, April, I hope you're remembering this because you're saying this exact same stuff. Like, here I am thinking that I'm going to be able to maintain with, just a little tiny shovel. Like, really, I'm not going to attack my giant yard and yard work with a teeny tiny shovel. It's going to take the rest of my life to maintain it. And if I want it to look nice, if I want to be healthy, I'm going to need to do all kinds of things all of the time. And yeah, there are going to be moments where my yard is going to look like a hot mess. There are going to be moments that my life is going to look like a hot mess, but it doesn't mean that it's a hot mess forever. And what I can lose sight of sometimes is that just because I have the tool, I actually have to do something with it. My yard is not going to look immaculate by me just standing there going, well, look at this, right? Like, I'm going to hold it and I'm not going to do anything with it. No. And that's where the frustration, I think, comes for a lot of bariatric patients. It's like, okay, I have my tool and I have some other tools, But if I'm just sitting with the tools and I'm not actually doing any work with them, nothing is going to change. And it's the mindset thing that we need to get over. And being able to talk to other people about this has been what propels me to actually do something about it, because it gets me out of my shame cycle. It moves me out of here, and it moves me into a space where people are reflecting what they're seeing, and they're questioning, and they're wondering, and they're encouraging. But if I was just up here, no way.
Yeah. And it's our perspective. Going back to what we said at the beginning, we have to own it, and we have to own our perspective. You know, I say all the time, you will see what you choose to see. You know, if you have a person that you work with and they get on your nerves and they're always condescending and they're always whatever it is, and that's what you talk about when you go home, and that's your thoughts of them every single day, I promise you the next day you go to work and you look at them, everything that comes out of their mouth will be short, condescending, arrogant, whatever it is. It's your perception. And I'm not saying that they may not be saying those things, but you choose to see what you want to see. And I think being able to see our success when it may not be defined as what we thought was success, because the scale is not necessarily dropping at a certain rate. You know, I read something one time, I've probably said it before on here because I use it all the time with patients, where 80% of our time is spent dwelling on the past or worrying about the future. And 20% of our time is spent in the present. And so 80% of our time, we have guilt or regret or shame about our past. And the other part of the 80% of the time, we have this anxiety worrying about the future. What if I don't lose the weight? What if I do gain it back? Right? Or the past of, I can't believe I made this decision. I can't believe yesterday I did this. I can't do that. And then 20% were today. Well, if we're so obsessed with yesterday and tomorrow, how can we change yesterday and tomorrow? If I win today, guess what today becomes? It becomes yesterday tomorrow. Today is my past tomorrow, right? And if I win today, I create opportunities for me for my future. So the time we spend the least in is the time that can change the two things we're obsessed with, of just winning today. If you made bad choices yesterday, or you didn't do exactly what you were hoping to do, what is pondering on that going to change about today? Let's just win today. Let's win today. And then guess what? Eventually when we start getting some wins in today, then our goals can be, I'd like to beat yesterday just a little bit. And yesterday was a good day, you know, and it can't always be focused on a number. And it's hard to not talk about that. I do not know what it's like to battle with that. I mean, there's times I don't like my weight where it is, or, you know, all sorts of things. I think we all have a form of body dysmorphia. I promise you, we all do in some form or fashion. But for that to be something that's really impacted our life, it's not fair for me to look at a patient who's battled with obesity most of their life and say, quit worrying about your weight, because that is important. That's why you had the surgery. But you also have to be focused on some of those other wins that you're having along the way, you know, and enjoying the process of moving forward. Laugh at yourself, you know, be willing to laugh at the mistakes that you've made, that you're human, and don't lose sight of the victories that you're having right now, because you've made your mind up that only a victory is hitting a goal weight or being in a size of a dress or what have you. You know, and we talk about non-scale victories all the time, but it doesn't have to be something as dramatic as I rode a roller coaster. It's dramatic. Natalie, like you said, I mean, you literally said, I've never stayed. This is the longest you've maintained forever. And it's not like you gained 50 pounds and then you maintained. Like, that's not it. You've maintained. No. That's great. And that doesn't mean you have to settle for that, but those are two separate topics. I may want more for myself, but I'm so proud of all the work that I did to get here. And now I can start working towards something different and realize it takes time to get there too, because look how long it took you to hit that goal that you just hit.
Well, and it's one of those things that there's such a freedom and a power of letting go of what the world sees as success in post-op, because people who have never had the surgery have all the ideas of what success looks like for people who have had surgery. And it is never anything other than what's the number on the scale say. What size you went? You look like you're a little thicker than last time I saw you. You've been going like, what's going on? What's your weight like? And my dad does that shit to me all the time, and it wears me out. Well, how much weight you lose? Why do you care? Like, what are you worried about? Like, you didn't ask me how much weight I gained when I was gaining weight when I was on the way up. Like, the fact that you guys are so preoccupied with what the hell I weigh now is amazing to me. But that's like the outside world is so concerned about what we do in the post-op, in post-op life. We have to shed the fact that we worry about that. Like, our successes have to be our successes for us. We can't be worried about what anybody else thinks about it, because at the end of the day, our journey is our journey. Like, we can't get, like, no one's going to help us get to where we are, just like no one helped us get where we were. So if we're going to do this, we have to be in it for the right reasons. You have to trust and care about yourself enough to continue to push forward, even when all the outside voices are so damn loud that, you're having a hard time focusing on what it is. Because at the end of the day, we went through this journey to save our lives and to be healthy. We don't, it wasn't about, oh, I got to get to this goal weight or I suck, or I got to do this or this. If I didn't do this, then I'm trash. I'm a horrible patient. Like, that's why we stress so much when we talk to people. Like, it's not about, if you're metabolically well and your labs can come back normal in the normal ranges, like, that's what we're fighting for. And it's super hard. Like, it is not the easiest mindset to get into. Trust me, that's one of the hardest things I dealt with, because it's so many people that were so concerned about what size I was in, or what the scale said, or how much this, or, what was that. Nobody cared about, what do your labs look like? I've never had anybody ask me that shit.
Or how do you feel? Right. Yeah.
Oh, when people make comments about what I look like, I say, oh, thanks. I feel so good.
Yeah.
Because that's all that matters.
And I think there are times that people mean well. They don't really know how to respond. They want to acknowledge the progress you've made.
Yes.
So they don't really know what to say. And so when you're public with the decision that you've made, you've had weight loss surgery, they think, okay, well, it's okay for me to say, you look amazing, because that's just human nature to say, I see the progress you're making. And there's times when it feels good, but like, just because you show up 6 months later and you look exactly like you did before, but your mind is in a better place, you're healthier. But you know what that goes back to is, are we doing it for the reward, or are we doing it for the right reasons? And I learned a lesson some time ago where, I was told, you have 100% control of your reactions and emotions to what's done to you, and no one else is responsible for that but you. And people can cuss you like a dog. I don't have the impact to tell them to stop. I can ask them. That doesn't mean they're going to, but I can choose how that makes me feel. And so it's so true. And so I think we have to shift our mind. I mean, I may not be dealing with my weight, but there can be other parts of my life where we have to shift our mind and say, I shouldn't let that reward dictate my behavior if it's the right thing to do. And so eventually those phrases may go away of, you look so great, because they've told you that 1,000 times. You're like, they've run out of things to say. So they just want to talk to Natalie and say, how's life? What's going on? But if we're dependent upon that motivating us to say, oh my gosh, I'm going to go back to the gym because I love how that makes me feel. That person's finally acknowledging my progress. You have to know your value. You have to know your progress. And that's why I want, when patients have their last visit with me before surgery, I warn them of this essentially. I warn them of, I have a phrase that says, beware of the feeling of what have I done? And because I said there's I used to say, I bet half of y'all in this room, and then I realized it's not half, it's every one of y'all. Every one of y'all in this room have had people that up to this part have questioned, why are you doing this? You don't need to do this. It's too dangerous. We've heard all that stuff before. We've been through that. But you all have made the decision to be here to have surgery. So it's not like I need to convince you to have surgery. You're here to sign your consents. But just wait, because there will be times in your life, it may be you're struggling. Your weight plateaus earlier than you thought. And those people around you may notice it too. And they're just waiting for something to not go perfect to say, told you so. And then those voices, or even if they don't say told you so, you remember those things that they said. And when you don't see you meeting the expectations that you set for yourself, when sometimes they're not even reasonable expectations, those voices get really loud. And you say, what have I done? And so I try to prepare them at the beginning. Know what we've talked about on here, what your why is, but know what the end game is. It's not always predicated on a size that continues to change, a scale number that continues to change. It's based on where are you now versus where you were. It's part of your journey. Are you making the choices today to try to be the best version of yourself that you can be? And that's all that should matter. If you do those things more often than not, you're going to win, you know?
Well, and we are always winning, even when we are pausing. Right. We think that a pause, we think that slowing down, we think that just staying the same is a form of losing, but it's not. Pausing is the most powerful thing we can do along this journey, because it can give us that space between our inner voice, those outer voices, and it allows us to really kind of process and ask ourselves the question, is this true? Right? Because that self-fulfilling prophecy is going to come back strong, just as like what you're saying, Dr. Smith. We have all asked ourselves, what have I done?
All right.
And if we do not get that pause, and if we do not allow that innermost voice of ours to overpower and to speak louder than the things that are coming in from here, it's going to be a hard cycle to break. But that pause and asking ourselves, is this true, can be a tool that we maybe aren't utilizing, but we could start. And it's the most powerful one that we can use to start fighting back against, right? Kind of those old voices, those outside voices, and what we thought this would be like. None of us went into surgery thinking this is what it would be like. But when you arrive here, it's important to know that you are not wrong. You're not thinking anything that anybody else, right, hasn't thought. You are exactly where you are supposed to be. And once we arrive here, it's how we know that the journey is kind of actually starting. That moment is your starting line. That moment is when the gun goes off and you can start running your race. Everything leading up to that was just you getting ready for this race.
I would challenge.
Go ahead.
No, go ahead.
I
would challenge.
The pause allows you to self-evaluate. You always have to take those times to self-evaluate, make sure that everything's running, your checklist is running like it needs to be. So the pause doesn't have to be anything extended. It can be something short that you can run through and just make sure that checklist is how you want.
Mm-hmm.
Yeah, no, absolutely. I would challenge any patient who's had bariatric surgery. And I mean, you could do it at any point, you could do it too early and it may not be as effective, but let's say you took everybody who's a year out from surgery. And I would challenge them to sit down and write down at least 5 things. You could probably write down a lot more, but write down 5 things, what you've gained from bariatric surgery versus from where you were before. But there's only one rule one thing that you can't do. It can't have anything to do with a size of a clothes or a number on a scale. And what I think would be more powerful is if you write those things down. I don't care if you put them on your bathroom mirror. I don't care if you put them in your phone. You can make them your screensaver. You can do whatever you want. You don't have any right to say that you're failing unless those things start to disappear. And that doesn't mean you're failing, but that may be an alert that, am I doing something wrong? That you gained, I am off. It could be, I'm off X medication. It could be, I obtained this job that I could never do before. I'm now coaching my son in Little League. It doesn't matter what it is, but you find those things and you write those down. I tell you what, that's a great deal if you stall at those 5 things. Wasn't that the point? Wasn't the point of you having surgery to have a healthier life and be able to achieve these things? Because these were probably things before surgery you're saying, I'll be happy if I can just do this. So pause, enjoy it. You're doing it. It's happy. Now, if you want to add 5 more things and that's a goal, that's great. But the process of adding those 5 more things doesn't mean you're a failure because you haven't added them yet. That's your next challenge of continue to do the right things because I want more for myself, because I know I deserve this and I'm worthy of this. So I want more for myself moving forward. But the pauses and the stalls are seen as these negative things, and they shouldn't be. The gains can be a problem, and there's fluctuations. I tell people your weight's like the stock market. Like your hope when you buy, except the opposite direction. Unfortunately, here recently, I feel like it's gone the other way. But when you invest in something, you hope in the future it's here. But my gosh, if you watch it every day, I'll flip through the little thing on my phone and you could drive yourself crazy because it's like this. And if you catch it on the wrong time, it's not where you want it to be. But when you zoom out, instead of looking at it daily, you look at it monthly, you look at it yearly, you look at it over 5 years, the trend is in the positive direction. That's our life. That's your post-bariatric surgery journey. There's good days and bad days, but your trend should be in the right direction. And just because you feel like you're staying the same, you've achieved all these new things that are part of your life and you've kept them. They weren't for a week. Somebody can get way down to a crazy number and get that perfect picture for Instagram to show that before and after. And if that was miserable to get there. Okay, I don't have to post for another 6 months. What is that? You are achieving new things that you're keeping every single day. That is winning.
And I think that's another tool. April and I journal a lot. We use gratitude journals. We pick things every day. What did I do today that I'm grateful for? Or what is something that happened today that I'm grateful for? And sometimes it's not about me. It's the sun was out, it felt nice to be outside, but I was outside and I could move. Well, I'm grateful for that. It's like you have to use that tool of gratitude to keep you going, because that's where I see a lot of folks and myself. I mean, when I'm not looking for those pieces of gratitude, that's where I fumble. That's where I start getting hard on myself. That's where my mental health goes down, tumbles down. I mean, you need those moments of gratitude and joy to keep you going. And having fun. I mean, you mentioned this earlier, Dr. Smith, I had the surgery because I'm still in my 20s and I want to have fun. I wanted to go and have fun and travel and be silly. And we're doing a foam fest run in June. None of these things could I ever do beforehand. I wanted to have fun and be silly, but then it's you just take it to this. So it is serious. It's a very serious disease, but we just get so serious and so hard on ourselves that the gratitude and the fun just totally get lost in the mix.
Right.
Yeah.
And it's you see people who battle with diseases like cancer, and there's a lot of unknowns sometimes for those patients. They may have a cancer that they know the odds are I'm going to beat this with the right treatment. And there's sometimes you're like, man, odds aren't great at all. But, so do you just put your life on hold until you get that final answer? Okay, I'm so afraid that I'm going to die from this cancer. I can't enjoy life. I can't enjoy time with my friends. I'm going to worry about this over and over and over and over and over again. But I'll be good when I get that call that it's gone. That call never comes. It's a disease. You have it. It may be in remission. You're going to have follow-ups for the rest of your life. So what you're waiting on to finally make you happy, it ain't coming, And I think weight loss many times is like that, because those expectations, even if they come, they don't bring the joy you were hoping for. And so why in the world miss life to get there? Don't become complacent and say, well, I've got forever and I'm actually going in the wrong direction, but I'll start again tomorrow. Do those things that are that we know are the right things to do, but enjoy the ride, because there's no guarantees in this. And your best result that you may ever achieve may be, if you want to put it in a quantified number like a scale, it may be 30 pounds higher than what you thought was going to be the ultimate success. So you chose to be miserable only to reach the endpoint that made you miserable? And enjoying yourself there, like you said, from a mental capacity sets you up for much more success, to see things in a different perspective, to see the off-color comments that may come our way and handle them differently. So those don't tear us down. So those don't steal from our joy that we've got in that journey to get there. And in the end, you probably have a better chance of hitting some of those big goals that you have for yourself, because you stayed in a healthier place to get there. Your health is your health. It's in your head, it's in your heart, it's in your body, it's all your health. And it's hard, I tell patients, I can't change your friends and family members and coworkers that say those things to you. You could bring them in. I could get on social media and I can make a video every single day, and I could preach and pound on the pulpit all I wanted to. They ain't going to change. There might be a few that change their perspective. So how about let's change you? And if you know the truth, then you can't let people steal that from you. So I think sometimes they probably look at me like, why are you telling me this? I'm here, doc. Like, I get it. I'm ready. I'm when I have surgery. Like, I know that this can help me. Why are you still preaching to me? Because I know that time is coming, and I want you to be so sure of the facts and so sure of your why that it can't be broken by the people who question it. Because we can't change those. We have to own how we respond to what gets thrown our way.
I just got to say, I swear to God, that is the most powerful piece of being connected with a community. It's that you don't, instead of focusing on changing other people's minds, no. It's my work has been changing my own mind. And if I am not surrounded by that education, by that, the resource, by the reaffirming of my feelings and emotions, by people who get it and understand it, I'm never going to change up here. That is what makes, and we hear this time and time again for BariNation members, is that they realize the power of the community is it's this safe place to change this, right? I can try on these different mindsets. I can onboard new education. I can practice, right? Like all of these big shifts, so that when people do come at me with something that is triggering or is hurtful or is right, maybe even what I used to think, I now have new tools. I now have new information. I have a new mindset, and I have a new sense of belonging that I didn't have before. And that's powerful enough to sometimes change their mind. But even if it doesn't change theirs, it changes yours to the point where when it comes at you, you don't care, right? Like, oh, whatever. Okay, well, you can think.
And that's the goal. That is the goal. It's an icing on the cake if it changes theirs, because you've impacted somebody else's perception.
Yeah.
But the goal is for you. And again, it goes back to the reward, right? Our reward shouldn't be, I finally convinced my Aunt Jane to not be such a moron in how she looks at my battle with obesity. She finally agrees with me. That should not be the only reason that we continue to do what we do, to just make Aunt Jane see it differently. Who cares what Aunt Jane thinks? That should not dictate our success, and it should not dictate our accountability of doing the right things. That's a secondary benefit if that happens. Yeah. But it has no bearing on why we do what we do, and if we feel good about what we do. And
a lot of times people need the community aspect of things to kind of work through not only why they're thinking the way they're thinking, but how to combat the thinking and the outside voices too. So when you have people to bounce that off of, or you hear how somebody else has dealt with something, or how somebody else may have used their tool to change their own mind, that usually gives people enough, confidence in themselves to break out of that shell and do that for themselves. And that's one of the biggest things we've seen in the community that makes it so amazing for us, is when we see those people that came in originally and just were kind of felt defeated and didn't know what to say or how to say it or what to even think about what was being said to them. And they have enough time for people kind of coming together in these groups and saying, well, this is, what I did. They take little pieces from everybody, but it boosts their own confidence to realize that they're not the ones that did something wrong, or they shouldn't feel bad about themselves, that they really should be excited about what they've done in their journey. And that's like what you have been saying the whole time. Like, that's the biggest piece, is be excited and clap for yourself before you're worried about who else is clapping for you.
Yes. And you know what? While you're saying that, it made me think of this, and it's so true. And the biggest mistake that I think people can make when they finally say, okay, I need community. And anybody who watches this out there, don't say I need community because I'm not getting my reward from my family and my friends, so I'm going to pay for it. I'm going to go to a support group because I'm going to expect all these people to know how I feel and say, for my membership fee, tell me how great I am and tell me what I've been begging to hear from these other people, because you're not fixing the problem. Those things will come because you're with people who have empathy for what you're dealing with, but don't be dependent upon other people to tell you what your worth is. You know your worth, right? And that comes with meeting with people in community, and they don't have to say, you know what, you're the best ever. They can say, I know what that feels like. I went through it too. And you can translate that into anything you want internally and what that's telling yourself. I can't tell you, and people may be surprised by this, but there's no better feeling as a surgeon than to operate on somebody and somebody thank you. Now, I know that sounds very basic, but a lot of times it doesn't happen. I will say that's one of the great things about bariatric surgery. We probably hear it more in that than in other categories of surgery and stuff like that. You know, people say, oh my gosh, you saved my life. And I'm like, no, I didn't save your life, but I helped you get on the right track. But there's lots of people involved, and I'm not sure I ever feel comfortable with taking that. But I know what they mean, and I appreciate it. And there's no better feeling than just that patient the day after surgery, all the surgeries I did today. If there's a patient tomorrow that says, thank you for giving me a chance or listening to me, or, you know, just a heartfelt thank you. It is the best feeling in the world. It's all I need. But the moment that I walk into the next room or the next room or the next room and I don't get that, and that dictates how I prepare for my next day of OR, or that dictates how determined I am to show up for work, or that dictates how passionate I am to go do surgery on somebody else because I'm waiting on that next one, I got to quit, you know? And we all fall victim to it. We want that. We love that. But guess what? When it happens, just eat it up and enjoy it like it's never going to happen again. It's icing on the cake, but it's not a requirement to drive us to do the right things.
Mm-hmm.
As always, this conversation went in the best possible direction. We always leave these conversations with new ways of approaching this disease, right? As we're trying to figure it out, we are trying to onboard these tools, or we're trying to really learn how we can utilize and maximize the ones that we already have. And I think it's such a powerful conversation when we can come together and acknowledge all of the things that we do have at our disposal, and just think about maybe new or creative ways to use what we already have. And we all have a tool, or if we're listening and watching, we're pre-op, you will have a tool soon that you can onboard. But right, your surgeon, your surgical team, your community, and the mindset tools that you are going to need are always going to be available to you. The key is to use them and to utilize them. It's one thing to have them. It's another thing to put them in action for yourself.
Yeah, they're yours, own them.
Yep,
Mm-hmm.
exactly.
And
They're ours.
If you're listening right now, you're already utilizing it.
Right.
So put that in your win box for today.
Look at you, Nat. Full circle.
You know.
Well, we also have this amazing tool called the BariNation membership community. If you don't know about it, or if you've heard about it, or you're thinking this might be a tool for you, we absolutely invite you to join us over there. It's a tool that all of us are using every single day along this journey. And it's the reason that I've been successful. Dare I say, it's the reason all three of us as patients have been successful. And Dr. Smith, we have to thank you. You've been such a supporter of community, of BariNation, of doing what we're doing. We are so eternally grateful for everything that you pour into this community.
Well, it's my pleasure. I'm grateful to have found you guys and have resources for my patients, and I'm grateful for what you guys offer to patients everywhere. You know, I feel like I feel like anybody who's had bariatric surgery, I look at them as my patient. And not that I did their surgery, but like, you know, I want to stand up for them or fight for them just like I would somebody that's my own, you know, because we can identify with that. And I'm grateful that there are resources like this, because we as physicians, not only do we not have the time, unfortunately, to offer this sometimes, but we don't have the resources. We've not lived this, you know, and patients need to hear it from people who've lived it, and patients need to hear it from different perspectives. My take on things may not always be effective for people. Just because it works for one may not work for the other one. And so I'm very grateful that you guys, you know, do this for patients, and that I've got that resource to refer people to.
Yeah, it's a true partnership, right? When the patient and the surgeon, when the patient and the experts come together, really amazing things happen. And it's because I think we finally feel safe enough to open up our perspective and possibilities, and to really take in what somebody else said. Because as you said, Dr. Smith, you could say something a million times, but it's that one time that you say it just slightly different and people can understand it. And as patients, if we're not keeping our eyes and our ears and our hearts open to this information, we're going to miss what we need. And it takes surgeons like you to also look around and go, wow, patients really do have a perspective that we didn't acknowledge or understand before. And if we just take the time to listen to them, I'm going to learn things that's going to benefit everybody. So when we come together, wow, really amazing things are created from that, you know, from that space. So thank you for being such an amazing, loud, kick-ass voice in the bariatric community.
It's loud. I've been told that a lot.
Hey,
We
louder
need
the
it.
better. Where, Dr. Smith, if people would like to follow you on Instagram, where can they do so?
It is Dr. Eric Smith _. And that's it. That's where you can follow me. Our website is KentuckyBariatricInstitute.com. You can go on there. That's for our practice, but you know, we post some fun stuff on Instagram. So yeah, please jump on there.
Oh yeah, your Instagram has been fire lately. Absolute fire. I just love seeing the pushback against the, you know, it's easy way out, or, you know, medication is easy. No. We so love and appreciate how you really are providing that stop to things that sometimes seem to be getting a little out of control. You are the voice of reason in this. So we appreciate it.
Yeah, absolutely.
Jason, my friend, you want to take us out?
Yes, ma'am. Dr. Smith, we thank you again for your time, your knowledge, your effort, and your support. It's truly amazing, and we can't thank you enough for that. The community, we thank you guys. We can't thank you enough, because all the things you do to help support us, the likes, the shares, the subscribes, the telling people that we exist, because, you know, the more people that we can help, the better off we're all going to be as a community. So we thank you guys for that. Don't forget, you can always rate us on your favorite podcast player, as well as on the Spotify app. You can, which used to be Anchor, which is now Spotify. You can leave us voice messages that we can incorporate into future episodes of the podcast, because it's just another way that we get to highlight you guys, which we love to do. You can also leave us ratings and reviews on YouTube as well. We're getting those numbers up, and we appreciate you guys for doing all the work that you've been doing. And just remember, at the end of the day, you've got this, we've got you, and we will see you next time.
Awesome. Thanks, friends.
Bye, everybody.
Bye.